Before we discuss specific information and referral issues related to dementia, let's spend some time digging into some of the resources you may want to provide to consumers and others who are impacted by dementia. Of course, the ADRC website is always a good starting place to find resources people need. It has information and links to many credible national resources. Here are some of the resources we've already reviewed and some additional resources you may find helpful. One resource that's likely to be helpful is the National Alzheimer's Association 24-hour, 7-day-a-week helpline. Care partners can call this number anytime to get answers to questions and to receive support in challenging situations. Helpline staff are well trained and able to talk through a variety of situations, and the helpline will help people with any kind of dementia, not just Alzheimer's. The National Institutes of Health Alzheimer's Disease Education and Referral Center, or NIH ADIR, has a great resource called Caring for a Person with Alzheimer's Disease. It's a booklet a person can download or order, and it's a helpful guide with lots of basic information. The Alzheimer's section of the ADRC website has medical information, including links to resources to help people know what to ask their healthcare provider. As we discussed in Module 3, obtaining a diagnosis as early as possible helps ensure that people diagnosed with dementia have every opportunity possible to make their wishes and preferences known. For those with a dementia diagnosis, the Alzheimer's Association has a special section of their site called I Have Alzheimer's Disease. This section features pages related to programs and support, what to expect, planning for the future, overcoming stigma, and living well with the disease, among others. You can see them on this banner. Once a person is diagnosed with dementia, some of the looming questions are often, when will he or she need to stop driving, or how can I get him or her to stop driving? The Alzheimer's Safety section of the ADRC website has a link to information, right here, to help prepare families to deal with this issue. Links include a connection to the Alzheimer's Association site with videos of 4 different scenarios related to the ways different families can work through these issues. You may also receive calls from loved ones who are long-distance caregivers. The National Institute on Aging, or NIA, has a site designed especially for these caregivers. Their publication called So Far Away, 20 Questions and Answers About Long-Distance Caregiving is a free booklet designed to help families with one or more long-distance caregivers to maneuver through issues related to aging and dementia. This booklet is available for download, or copies can be ordered and mailed. For those caring for veterans, the Veterans Administration, or VA, has a support line for caregivers, as well as a great site called Caregiver Support for Veterans. The helpline and VA caregiver services are even available for those caring for veterans who are not currently enrolled in VA services. The Alzheimer's section of the ADRC website has links to information on Alzheimer's and dementias other than Alzheimer's disease. These are just some of the resources you may want to share with families and individuals. Remember that support groups, caregiver training, and the Family Caregiver Support Program at each Area Agency on Aging, or AAA, can be helpful resources. Caregivers can also access respite care through in-home and adult day programs where available. We encourage you to be familiar with each of these so you can give up-to-date information. We also encourage you to start a list of resources unique to your own community and to the needs of consumers living in your community, and to share these resources that you learn about with your local database specialist. These may include resources related to transportation, support groups, senior centers, meal programs, medical equipment and supplies, and other resources. Try to remember that not all calls with people dealing with dementia will go smoothly. In fact, many of these calls can be challenging for a variety of reasons. If a consumer has dementia, he or she may not necessarily be able to recall the conversation they have with you. So, as we discussed in earlier modules, do your best to assist the person and encourage the person to call back with any other questions. No matter what, leave the door open for further interactions. Try and obtain contact information for the person's family with permission. Remember, you may not be able to actually provide the support, but you can connect people to resources that will help them get what they need.